right now. Maybe just a very quick introduction. My name is Joan Lowe, and I'm the founder and CEO for Thoughtfull. We are a digital mental health startup that's based in Singapore, and really our vision is to make access to end-to-end mental health care more accessible and affordable for people. I think one of the things that perhaps I'll just change the angle a little bit. We've just spent the last 20 minutes kind of focusing on the macro perspective of digital health. The plus, the minuses, and kind of the characteristics. I'm going to just start from the micro first and then kind of tie it in. So really how Thoughtfull was started is because there was a very real use case of how it was almost impossible and until today to get access to end-to-end care for mental health. This is something I know personally. We have been caregivers for the last 20 years. That's how I switched from finance in Hong Kong to this. And I think it's one of the aspects that is most fragmented in the system. And when I say most fragmented, I mean it in a therapeutic focus. So if you look at things like cancer, diabetes, any other kind of therapeutic area, majority of your treatment as a user that you're going to receive will happen in the medical system. They will happen in a clinic, they will happen in a hospital, and it will be administered by medical doctors. When it comes to mental health care, and this is specifically true here in Asia, what you'll find is that majority of treatment is actually administered outside of this system. Allied health workers, as we call them here, counselors and psychologists, predominantly do not sit in this system of a medical setting. Majority of them are either private practitioners, independent practitioners, and they're kind of fragmented all over the place. They don't even have access to EHRs, so electronic health record systems at scale, which is very different to what you'll see in all the other different kind of specialists, right? So I think the challenge set is quite different in mental health care. There is some infrastructure building that needs to be done. So, creating the plumbing that happens. How are we connecting this very fragmented ecosystem of care providers in mental health? How do we digitize them, standardize them, come up with universal standards of quality? How do we ensure that things are done in a way that's safe and secure, both not just for the user's data and health, but also on the professional side, right? How do we ensure that they are taken care of? And so I think a lot of the work that we do evolves around solving these ecosystem issues in mental health care. It is definitely something that is a work in progress. I'm not going to lie. It's not going to happen overnight. Rome was not built overnight, let's just say. And so I think for us, how we've been going about it is doing it through our one-stop platforms, both on Thoughtfull Chat for users, as well as Thoughtfull Chat Pro for the clinicians. And both have very different I would say value propositions that's needed, right? So on the everyday man on the street, I think even starting to engage with their mental health is something that needs a little bit more convincing than anything else, just because stigma is still an issue here, not just in Asia, actually everywhere, but I think particularly so in Asia, it's it's very magnified. And so through Thoughtfull Chat, we do provide that first port of call for anyone to engage at any point in their mental health journey. They could be more on the preventive side, where it's more focused on wellness, self-driven content, self-monitoring, all of those things. Or it could, slowly escalate into the curative aspects. Do they need one-on-one behavioral coaching? Do they need therapy? Do they need, perhaps even pharmacological access? All of these things are, things that we're mapping out so that it's seamless. And on the flip side of that, I think to make something seamless, you need the piping and the infrastructure for it to happen. And so that's where Thoughtfull Chat Pro comes in. We are digitizing the largest network of mental health professionals in the region. And I think there's a lot of work that's going into making sure that there is a universal, kind of standards of care delivery. And it's really a means for them to digitize the practice at scale. So yeah, I'll just stop here if there are any other questions. Yeah.